To begin the cardiac examination, start by sanitizing your hands. Make your patient feel comfortable. Introduce yourself and let them know you'll be performing a cardiac examination. The patient should be seated at 45 degrees. Once the patient is comfortable, begin a general examination of the whole body. Look for facial characteristics, syndromic features, deformities, or scars. Notable syndromes in cardiology are Down syndrome, Marfan syndrome, and Turner syndrome. We now begin our focus on the hands. Inspect the hands, fingers and nails for stigmata of infective endocarditis. Next, examine the radial pulse of the wrist with your first two fingers, noting the rate, rhythm and character of the pulse. Note the regular pulse of sinus rhythm. Test for radio-radial delay by checking the pulse at both wrists simultaneously. Take the patient's blood pressure. Now focus on the patient's face. Examine the eyes for xanthelasma and anemic conjunctival pallor. Ask the patient to open their mouth. Examine the mouth for quality of dentition and the presence of high arched palate seen in Marfan syndrome. Inspect their neck. The jugular venous pressure is visible anterior to the sternocleidomastoid muscle. Apply moderate pressure to the abdomen to demonstrate hepatojugular reflux. Palpate and auscultate the carotids. Be sure to do this on both sides of the neck, one after the other. Use your hand to feel for the apex beat, and use your other hand to count the rib spaces to identify displacement. Palpate for a right ventricular heave present in pulmonary hypertension or right ventricular failure. Feel for thrills in all 4 valve areas. Move on to auscultation of these areas with the diaphragm and bell of a stethoscope. If using a modern single-sided stethoscope, press down firmly for diaphragm function and lightly for bell function. Note the heart sounds, any splitting, murmurs, and added sounds. We'll now go through a few maneuvers to accentuate any murmurs or irregularities. Ask the patient to roll on their left side using the diaphragm part of the stethoscope over the mitral valve. Ask the patient to breathe in. Ask the patient to breathe out. The next maneuver is the Valsalva. This will decrease the preload and accentuate the murmurs of hypertrophic obstructive cardiomyopathy and mitral valve prolapse. Next, ask the patient to grip their hands together and pull apart. This will increase the afterload and accentuate murmurs related to retrograde blood flow, including mitral regurgitation, aortic regurgitation, and ventricular septal defect. Ask the patient to sit forward. Percuss and auscultate the lungs for pleural effusions or crackles, suggesting pulmonary edema. Ask the patient to lay flat on the bed. Palpate for hepatomegaly, pulsatile liver, or ascites in right heart failure. Assess the lower limbs for edema, pulses, scars, and clubbing. Let your patient know the examination is complete and thank them for their time. And don't forget to re-wash your hands.